Hi, everyone, and welcome to the Child Anxiety Fact Podcast. My name is Dawn Friedman, and I'm the owner of Child Anxiety Support, a membership for parents of anxious kids. I have my master's in clinical counseling and additional postgraduate training in child anxiety disorders, including exposure and response prevention and the Supportive Parenting for Anxious Childhood Emotions program, or SPACE program, which was designed by Dr. Ellie Lebowitz of the Yale Child Study Center. I'm also certified in infant-toddler mental health. FACT stands for Frequently Asked Questions, and each week I'll be answering your questions about childhood and teen anxiety. Let's get started. This week's question is, can children have panic attacks? And the answer is yes, although some people get confused by this because whether or not children can have panic disorder is a source of some controversy. So let's get into that a little bit, and let's start with defining panic attacks. The diagnostic criteria for a panic attack per the DSM-5 includes 4 or more of these symptoms: recurrent heart palpitations or increased heart rate, sweating, trembling, shortness of breath, chest pain, feeling as if you're choking, nausea or stomach ache, dizziness, chills or feeling hot, numbness or tingling, derealization or depersonalization, which is a feeling as if you're stepping outside of reality, as if the world around you isn't real, as if you yourself aren't real, or as if you're looking at yourself reacting, a fear of going crazy, that's in quotes, or losing control, and a fear of dying. So if there are 4 or more of those symptoms present in a moment of extreme anxiety, that would be considered a panic attack. And yes, children can have them. A panic disorder means that those panic attacks are coming out of the blue. They don't seem connected to anything. Panic attacks tend to occur because of an anxious event. So if you have, say, a social anxiety disorder and you're asked to stand up and give a toast at a dinner party and you have a panic attack, that's related to your social anxiety disorder. If it's disconnected from anything, seems to come from out of the blue, that's considered part of a panic disorder. Now, understandably, panic attacks can add to anxiety, meaning they become an anxious event all by themselves. An example would be, again, a child with a social anxiety disorder who has a panic attack at a social event may now worry about having a panic attack along with their worry about the social event. So panic attacks definitely complicate matters. We can become focused on those and maybe struggle to see the anxiety that's underlying it. When panic attacks come from out of the blue and don't seem to have a connected or predictable trigger and just happen, those are scariest of all. It can really feel like you're going crazy. It's one thing to have a panic attack if a big dog jumps on you, but it's entirely different to have one for no discernible reason. So the discussion about panic attacks in children argues that they are very uncommon in young children. The DSM itself reports that they rarely occur in children under 14. I'll tell you that that does not reflect my observation. I hear reports of panic attacks in younger children often enough that I think they may have been previously underreported. I recently read some research about that, and there was an argument made, an argument I agree with, by the way, that children can be experiencing panic attacks and just not have the language to describe them. When you think about those symptoms I just listed, some of them are kind of murky. Kids may not have access to language to describe their experience with them. They may know that their tummy hurts, but they may not have words to describe feeling shaky or sweaty, and they are very unlikely to be able to describe feelings of depersonalization or derealization. There's a whole argument about what a child is capable of developmentally. If a child is too young to have a strong sense of self, are they capable of experiencing depersonalization? Can a preschooler who is still learning the difference between fantasy and reality experience derealization? And can they tell us about it if they do? My guess is that a panic attack in a very young child looks like a meltdown. It looks like fear. And isn't that ultimately what panic is? It's fear. Would we view a panic attack differently if we thought of it as a fear attack? That said, generally panic attacks in children and adolescents are less likely to be related to panic disorder, those panic attacks that come out of the blue, and are more likely to be related to another diagnosable anxiety issue, such as separation anxiety, social anxiety, or generalized anxiety. But they definitely do exist in kids. Children who describe more somatic symptoms like tummy aches before school, headaches after school, feeling dizzy when they're worried, they seem to be at a higher risk to develop full-blown panic attacks. This may have something to do with perceived sensitivity to bodily changes. What this means is that a child who is highly sensitive to feeling, say, heart palpitations or noticing that they're getting sweaty may be more likely to interpret this as rising anxiety. Our brains are trained to interpret bodily sensations and make sense of them. So if we are prone to having a kind of anxiety thinking, a little more negative outlook, then when your heart rate goes up, you may be more prone to say, my heart must be beating faster because I'm afraid of something. Let me look around and see what there is to be afraid of. Obviously, children aren't thinking this A, B, C. If my heart rate goes up, then I have fear. I am looking for fear. It's more instantaneous than that. They feel their heart rate go up and immediately they're on high alert because they have the kind of brain that is prepared to look for danger. This also may explain why there's a strong genetic component to panic disorder, speaking to those brain differences. And in fact, the research shows us that panic disorder and panic attacks do seem to run in families. Interestingly, having asthma is associated with panic disorder, but also having asthma in the family is a predictor of panic attacks. In other words, if a child has a parent or a grandparent who has asthma, they may be more likely to experience those somatic symptoms and they may be more vulnerable to panic attacks. Again, this might be traced to a family sensitivity to bodily differences, particularly around breathing. And speaking of breathing, this is kind of interesting. It's in the DSM under panic attacks, and I thought I'd share because it's something I've seen in my office. Under their discussion of cultural issues related to diagnosing panic disorder, they talk about a Vietnamese concept of, quote, hit by the wind, end quote, which describes having a panic attack after walking out into the wind and having it take your breath away. And I have had so many parents tell me that their kids get anxious or even meltdown on windy days. And I think, okay, these kids are feeling like they've been hit by the wind, and we don't have the same cultural container to talk about that. In any case, children who report panic symptoms are also more likely to have separation anxiety. There's been some research that shows that parents who have a panic disorder or who have panic attacks are themselves more likely to have children with a separation anxiety disorder. What's the connection there? We don't really know, but I think it points to the need to acknowledge that anxiety disorders are complicated and that it makes the most sense to consider the presentation and the needs of the entire family. Treatment for panic attacks is the same as treatment for other forms of anxiety, which is cognitive behavioral therapy and sometimes medication. The particulars for that treatment will depend on the presentation and age of the child or teen. But in general, we work on helping the child to calm their body and increase their distress tolerance, and also to limit their avoidance of the things that scare them. If a child is avoiding a certain place or a certain event because they've had a panic attack there, we're going to try to get them to face that event or face that place and get themselves through it. This discussion we're having today about panic attacks, panic disorder, and diagnoses, I think it's useful because it helps us see the limits of our understanding of individual experiences. We can't climb inside a 6-year-old's brain to see what they're experiencing, and their ability to communicate it to us is limited. Looking at the criteria of diagnosis can help us know what questions to ask, what diagnosis to consider, what diagnoses to rule out, and how to case conceptualize in order to create the most effective intervention. But people, including children, are complicated and rarely fit into neatly prescribed categories. And this is especially true of anxiety, which is often co-diagnosed with other issues, and the different anxiety diagnoses tend to overlap. I think it makes the most sense to always keep an eye on the research, but also be open to tweaking what we know if the individual in front of us is a little bit outside the guidelines. If a child's meltdown looks like it might be a panic attack, we might consider thinking of it as a panic attack and addressing it accordingly. Intervening early is always a good idea when it comes to kids. They don't need a full-blown anxiety diagnosis to benefit from the skill building that comes with recognizing their worries and helping them shift their thinking in ways that empower them to face those fears. So, if you have a child who has somatic symptoms of anxiety but doesn't quite meet criteria for a full anxiety diagnosis, I still think it makes sense to address those issues. It will strengthen them in the long run and help their path become easier. Thank you so much for tuning in this week. If you have a question you would like me to answer on the show, please go to childanxietysupport.com/FAQ. And if you'd like to learn more about the Child Anxiety Support membership, please go to childanxietysupport.com. The membership offers courses, live events, and community to help you design a personalized program to free your family from the trap of child anxiety. I hope you'll consider subscribing to the podcast and sharing it with any friends or family who you think might find it helpful. You can get more of my child anxiety content over at Instagram, where I'm Dawn Friedman, MSED, or on Facebook at the Child Anxiety Support page. Thanks again, and have a great week.